Well, according to recent statistics, there are more than 2.5 million breast cancer survivors living in the United States, and those are positive numbers. But we're hoping to increase those statistics in the years to come. And although there is no known cure for breast cancer currently, as you know, there are some new medical advances and effective treatments for the disease. Joining us once again this morning to talk about these developments, Dr. Kurt Tower, an oncologist with the West Clinic in Memphis, Tennessee. He's here as part of our Hear Us Roar Healthy Living Corner, a partnership we share with Women Magazine. Welcome back to the show, Dr. Tower.
Thanks. Glad to be here.
I do want to talk a little bit about the new advances in the world of breast cancer treatment, because I understand that genetics is playing a new role not just in cancer diagnosis, but in cancer treatment. Tell me about this.
This is really a neat development in the treatment of breast cancer, because what some very smart people have figured out is that they can look at the cancer cells themselves and they can pick out 21 different genes inside those cancer cells. Genes are like on and off switches. They're either on or off. And so for each individual patient, that pattern is unique, and the computer can figure that out, and they can tell us whether or not that woman has a high risk of her cancer coming back, a low risk, or a medium risk. This is the area called genomics. It's one of the most exciting new areas in breast cancer right now.
So does this mean then that treatment therapies, for example, can be more individualized than ever before? Because to me, if that's the case, this seems like a huge advance.
Well, it's a great advance. This Oncotype test is such a great advance because it tells us who not to treat. So many times in early stage breast cancer, so many women would have to undergo chemotherapy when we knew their prognosis was great. But we didn't know which one of them would do well and which one wouldn't, so we treated everyone. Now we can figure out who to treat, who has the low risk, who has the high risk, who needs chemo, who doesn't need chemo, and it really helps. And it really helps us prevent treating patients that don't need the treatment.
And you know what, it's interesting you say that, because I do want to talk a little bit about the chemotherapy part of this, because the Oncotype test then can help doctors determine before treatment then whether or not chemotherapy might be an effective treatment option for individuals.
That's exactly right. When the Oncotype test comes back, it gives us a low risk, a high risk, or a medium risk. Low risk, no chemo needed, just tamoxifen. High risk, chemo, no tamoxifen, or maybe some tamoxifen. The intermediate risk is the one that's still a question, but it helps us so much individualize the treatment for each patient.
And you know, it's interesting to me because there's a personal connection for me. I was telling you before that my mother's mother died of breast cancer when my mother was 3. My grandmother, I never knew her. My mother barely knew her. So it really is just a personal thing in my family. But when I was researching for today's interview, I came across something interesting: bone complications that can occur in breast cancer patients. This is something I have never heard about.
Well, when cancer spreads, breast cancer particularly, can go to the bones. And so you don't have bone cancer, you have breast cancer in your bone because the breast cancer cells have traveled there and started to grow there. Okay. There's several treatments. Zometa is a treatment that's been around for a long time that helps strengthen the bone. But there's an exciting new treatment called Exgiva that actually attacks the normal modulator of bone metabolism called rank ligand and shuts it down. It shuts down the bone metabolism. It shuts down the tumor's ability to destroy the bone. It's an exciting new treatment.
Let me ask you this then. When you talk about these new treatments, can they then potentially increase survival rate?
They can increase survival rate, perhaps, but they can certainly improve quality of life during that survival, because bony metastases can have fractures and spinal cord compression and a lot of terrible things that can happen to the patients, and these can help prevent those.
Well, some really great information. Thank you so much for joining us and telling us about these new advances in breast cancer research and treatment. Thank you again, Dr. Tower.
Great. Thanks for having me.
Absolutely. Anytime. And if you'd like more information about these new advances in the treatment of breast cancer, check out the website, cancerconnect.com. And if you like what you've seen here today, keep watching The Balancing Act for more great information from our Hear Us Roar Healthy Living Corner.